I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. A reminder is that after the pep talk, take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. We have placed the link in the chat box. Another reminder, obtaining 50 OLED certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. I think we are now on our 123rd pep talk. So any mentee or all mentees have a chance to get at least 3 OLED certificates now because 123 na ang ating pep talk. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Now let's have a group picture taking first before we start the pep talk proper. Set, everybody. Please show your beautiful faces. Okay. Jen, okay. 1, 2, I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started this pep talk, the pep talk, on May 15, 2021. There are 3 courses in the pep talk. I completed the core course as shown here down below on October 9, 2021. And then from October 23, 2021 onwards, I have been tackling health disorder courses and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. We are now actually on our 3rd year. My pep talk today is entitled Mouth and Dental Health. The empowerment objective is for the lay people to have an essential understanding of mouth and dental health in their health management. Contents of this particular pep talk will be the following: what is mouth health, what is an oral health, what is a dental health, what are the components of the mouth, yung bibig, what are the parameters of healthy mouth and teeth. So when you say that one has healthy mouth, one has healthy teeth, what are the causes of unhealthy mouth, how to promote a healthy mouth, what are the parameters of healthy teeth, and what are the causes of unhealthy teeth, and how to promote healthy teeth. So essentially, these are the basic components of my talk today. So I'd like to have a disclaimer here. My talk will contain my thoughts, perceptions, opinions, and recommendations culled from experience of others as well as from personal experiences. Let's start with what is a mouth health, oral health, and dental health. Operationally, we will use mouth and oral health, or mouth and oral to mean the same thing. So we will use them interchangeably. Oral is more of a technical term, mouth is more of a layman's term, but essentially they are the same. Dental, as we know, that it means the teeth. So the teeth are components of the mouth. Teeth are within the mouth. So there are other components in the mouth aside from the teeth. So you have the tongue, the salivary glands, the gum, the palate, palate, etc., etc. Okay. So though the mouth health includes the teeth, we will have a separate discussion on teeth health. That's why I entitled the talk as Mouth and Dental Health, okay, for the purpose of separating, focusing on mouth health and then also on dental health. Okay. So when you say mouth or oral health, it means that there is no wellness or well-being problems with the mouth or oral cavity. The difference between wellness and well-being is that wellness is more on the physical aspect. Well-being includes not only the physical aspect, but the psychosocial and mental aspect of the person. Mental health, on the other hand, means there's no wellness, well-being problems with the teeth, with the ngipin. Okay. Now, what are the components of the mouth? So, strictly speaking, these are the loose components, but in some textbook in medicine, now we have different components. Now, okay. So anyway, I won't go into that. We'll just mention the components of the mouth. Okay. So you have the hard palate, yung langa, okay? Yung sa taas, yung matigas. Then soft palate, and then the inside of the cheek, we call that the buccal mucosa, inside of the cheek. And then retromolar trigone is that area between the upper and lower teeth. Okay. And then the gum. Okay. So yung mga gingivitis, and gum. Na? Lower lip, okay. That's part of the mouth. And then the tongue. Okay. The tongue actually consists of, strictly speaking, in medicine, we divided the tongue into the anterior 2/3, mas malaki, then the posterior 1/3. Na? Yung 1/3 is actually part of another cavity. Na? Okay. But anyway, as I said, we won't go into that. Then tonsils. Tonsils, strictly speaking, again, is not really part of the medical definition of mouth. It's part of the oropharynx. No? Okay, but we would include it here. Uvula, yung nakaluwit doon sa itaas na palate. And then, of course, the upper lip. Then also, we divide, when we talk about the mouth, we talk about sa itaas, dorsal side, okay, upper side, and then the underside, and then the floor of the mouth. Floor of the mouth. Doon sa ilalim ng dila. No? Kung tinaas ang dila, doon sa ilalim, doon sa, parang may gutter doon. No? Okay. As I said, we will have separate discussion on mouth health and dental health. Why is mouth and dental health important to know? Our mouth and dental health is or are more important than we might realize. So don't belittle it, because they are the window to the overall health of a human being. Problems in the mouth and teeth can affect the rest of the human body. It can also cause ill sense of wellness in terms of physical, masakit, may problema, and then ill sense of well-being, malungkot na tayo kasi may sakit, nadidepress tayo. Okay? So well-being includes the biopsychosocial aspect of health. We know that eating is one of the most frequent human behavior that brings enjoyment in life. It's just say most frequent, may mga tao ayaw rin kumain, no? walang drive sa pagkain, walang gusto. Okay? But a lot of people find enjoyment in eating. Unhealthy mouth and dental health can prevent enjoyment in eating and therefore in life. Pag masakit ang bibig, ang ngipin, hindi siya makakain, hindi siya makaka-enjoy. Okay? So it will also affect the enjoyment in life. What are the parameters for healthy mouth and healthy teeth? When you say healthy mouth, as I said, healthy teeth is one of the components of the mouth, so it's equivalent to healthy oral cavity and healthy teeth. Pag pinabuo natin, when I say what is healthy mouth, kasama na yung ngipin, healthy teeth. Okay. The healthy mouth has no evidence of injuries, walang sugat, walang bukol, lumps, walang ulcers, yung mga uka-uka dyan sa balat, we don't call that balat, we call that mucosa. Okay, yung sa lips, we can call that balat. No? Yung sa loob ng yung pinkish, reddish lining of the mouth, we call that mucosa. No? Kung minsan may mga uka-uka doon, we call that ulcerations. Then plaques, may mga puting patches, no? Unusual color, medyo may tape, may ano, hindi siya pangkaraniwan. Unusual color on and underneath the tongue, anywhere, cheeks, meron din, gums, and untreated tooth decay. So alam natin may kadalasan may tooth decay tayo. So pag hindi natin pinagamot, no, that's equivalent to have to be in a status of unhealthy mouth. Teeth should not, when I say healthy mouth, kasama yung teeth na rin, di ba? Okay, teeth should not be wiggly. Hindi siya gumagalaw-galaw, but firmly attached to the gingiva and bone. Pag gumagalaw-galaw, na-istorbo na tayo. Minsan, malungkot na tayo. It should not hurt to chew or during brushing the teeth. Pag sumasakit ng ngipin natin, pag kumakain tayo, we don't call that a healthy mouth. It's an unhealthy mouth. What are the parameters of a healthy mouth? Ihiwalay na natin yung teeth. Okay? A healthy mouth has no evidence, walang ebidensya na sugat, injuries, lumps, ulcers, plaques, unusual color on the lining of the components of the mouth. So, ito usually, just sum it up into these 5 elements: injuries, lumps, ulcers, plaques, and discolorations. Madaling tandaan yan, di ba? Walang sugat, walang bukol, walang ulcerations, walang plaques, walang discoloration. Now, injuries. Usually, ang injuries pag nasugatan, no, usually it's due accidental. Ang pinaka-common, I think, is accidental self-biting of the lips or the tongue. I think all of us have experienced that. Pag kumain tayo, accidentally, nababite natin yung lips natin or tongues or even the side of the mouth, no? The lining, sakit, di ba? And then injuries from dentures, yung mga may mga pustiso, no? And then of course external source of injury, yung nahulog, tumama yung lips dun sa pader o sa lupa. Now, lumps, when you say lumps, yung mga bukol-bukol yun. Bukol-bukol, which can either be, when you talk about lumps, it's a question of whether is it cancer or not. Or, in other words, is it benign or malignant? So, when you say lumps, usually tumors. So, let me give examples of tumors on the lips. So, ito, may tumor dito, may bukol siya rito sa labi, sa lower lip. No? So, kung transparent siya, parang may fluid, we call that mucocil. Mucocil, baka kasi yung mga lips nagpo-produce ng mga substances which we call mucus. No? So, pag nag-collect siya doon, no? Magiging bukol siya, that we call that mucocil. No? So, usually, pwedeng isip-sipin lang yan o tatanggalin, no? Operahan. No? And then squamous cell carcinoma on the lips is also a tumor. Okay, this is an example of a tumor on the lower lip. Yung itsura niya, pwedeng parang wart, pero totoo lang ito, this turned out to be cancer. No? Cancer of the lower lip. No? So yung mga bukol na pag may sira yung mucus, yung lining, usually masama. No? Basta hindi siya yung ulcers. No? Okay. O, yung pangit tingnan, usually kung pangit tingnan yung in general, sa layman, pangit ang bukol niya yan, ganon, no? Wala siyang lining, no? Parang ito, may lining ito sa mucocil, mas maganda, no? Pag meron ganito, suspect siya na cancer of the lower lip, no? And the most common type of cancer dito, we call that squamous cell carcinoma. There are other 2 types of cancer. Tinatawag na basal cell carcinoma at saka melanoma. Melanoma, usually itim ang itsura. I might show you examples of melanoma later on. Ito naman, tumors of the tongue. Okay. So ito, look, ito yung tongue. Actually, this is not really a tumor, but a enlargement, abnormal enlargement, congenital ito. Malaki yung what do you call that, tongue. Okay. So, macroglossia. No? And then, ito, may ulceration dito, no? May uka, no? Pangit tingnan, di ba? So, once may pangit tingnan dito, usually, we suspect cancer. So, this turned out to be tongue cancer carcinoma inside 2, cells carcinoma. Ito naman, medyo itim-itim, kumisan sa tongue, sa dila, we can suspect melanoma, the type of cancer of the tongue, melanoma, may mga parang mole na naging cancer. Okay? But with the history, palagi niya nasusugatan itong dila niya at hindi siya gumagaling na maganda at look at ito yung tinatawag na granuloma pyogenicum. Benign ito, hindi mo siya cancer. So, gagawin lang dito, tatanggalin lang itong bukol na benign. No? Tumors of the hard palate. This is the hard palate sa itaas, yung matigas na roof. Okay? Ito, may matigas na buto dito. We call that torus palatinus. May mga tao meron ganito. I don't know the real cause, pero ako, I try to avoid yung mga sumisipsip na hard candy. Yung pag sumisipsip tayo ng hard candy, kung saan kadalasan tumatama dito sa roof of the mouth, di ba? So baka chronic irritation, sa aking palagay lang, chronic irritation can cause this lalaki itong mga buto-buto dito sa taas. No? But it's benign, it's not cancer. No? Yung buto lang lumalaki abnormally. Ito naman may bukol dito sa hard palate. No? Fleshy siya, okay. Hindi siya buto. No? So pag meron ganito, yung covering of the bukol is malinaw, smooth na smooth, and this is what is usually caused by tumor of the minor salivary gland. No? Dito kasi sa bibig natin may mga salivary gland tayo, yung nagpo-produce ng saliva. Okay, kumisan, pag minalas tayo, one of the salivary gland can form into a tumor. No? Yan, lumaki siya ito. Okay. Now, ito naman, sa lining of the mouth. Lining of the mouth, yung tawag namin buccal mucosa. Okay. Ito, may sugat siya. Okay. May, tumagos na sa balat ng mukha. No? Pag meron ganitong itsura, malaking chance na cancer na siya. No? So, ang clue that it's cancer, usually pangit talagang tingnan at talagang hindi gumagaling. No? Okay. So, this turned out to be buccal carcinoma. Okay. So, nagtagos siya from buccal sa loob hanggang lumabas. Ang kinain kasi cancer invades, nag-invade yung mga cancer. Ito naman, sa floor of the mouth, kanina sinabi ko, the underside of the mouth and then floor of the mouth, itong bladder, ito, pangit ang itsura nito, di ba? Uka-uka, no? Matagal ito, hindi gumagaling, no? So we suspect floor of the mouth cancer, no? Ito, another patient. So, gingiva naman, yung gum, so pwedeng, ito, may bukol dito, granuloma pyogenicum dito, so laging probably nasusugatan sa toothbrush, no? Nagkakaroon ng sugat, then nagkaroon siya yung tawag na bukol na benign naman. No? Ang gagawin lang ito, curate lang, itatanggal. Pero ito, kanina sinabi ko, yung pag may itim na bukol, yan ang clue, baka cancer, melanoma siya, melanoma. No? Okay. So this turned out to be melanoma of the upper gum. So, after the lumps, kanina injuries, then lumps, then ngayon ulcers naman. Ang ulcer is the loss of erosion of the delicate lining of the mouth, yung membrane, mucous membrane. So, the causes of the ulcerations, as I said, loss of erosion, so just call it uka, ng liit, uka. So, causes usually injury. Pag nagkaroon ka ng injury, baka malacerate yung mucosa. Okay, so you can end up with an ulceration. Then infection, yung mga singaw, parang singaw. Okay, we call it singaw, herpes simplex yun. May mga uka-uka rin yung ulcers. No? Then of course, cancer can also present as ulcerations. Examples I've shown you earlier. Ito, example of ulcerations, may uka erosions of the lower lip. No? dito naman, erosions o maliit na ulcers na sa dila. No? So this can be caused by baka nakagat niya accidentally, yan nagkaroon ng ulcerations, no? Mag-heal naman yan after a while. No? Or kung di niya nakagat, maglumabas yan, baka herpes simplex or singaw. No? Baka parang ganito. No? Okay. Or sometimes, sana hindi, it can also turn out to be the earlier stage of cancer. No? Okay. So babantayan lang ito. Pag nawala ito within 2 weeks, wala nang problema. Okay. Plaques naman, plaques are sticky substances on the surface of the lining of the parts of the mouth, usually white ang kulay. No? Ito, white. No? Okay. Minsan, baka sabihin mo, milk curds lang yan. Yung milk curds natatanggal. Pero pag ayaw matanggal, medyo may, may ibig sabihin siya. No? The more common causes are infection, pwedeng viral infection or fungal infection, or even cancer pwede rin. Yung mga rare, may mga cancer na present as plaques also, lalo na in early stage of yung tawag na squamous cell carcinoma. Discoloration. Unusual, when you say discoloration, there's unusual coloring of the lining, usually pink normal kulay ng lining of the mouth. No? So ito medyo may itim-itim example, discoloration. Ito itim so, no? Okay. So pag meron ganitong itim, we suspect melanoma. Okay. So yung mga more common causes of this abnormal discoloration will be vitamins or mineral insufficiency, kulang sa vitamin, melanoma, example like this, and then very common because marami nagki-chemotherapy in all over the world, marami tayong nakikita side effect of the chemo is may mga bluish discoloration, no, ng labi, no, ng dila, ng ganun. So again, to repeat, what are the causes of unhealthy mouth? Mouth ito, hiniwalay natin yung teeth. So injuries, infections, vitamins and mineral insufficiency, chemotherapy-induced discolorations. Ito yung pinaka-more common. And then, of course, benign tumors, okay, and malignant tumors. Benign and malignant tumors are usually caused by some genetic factor, pero kung di siya, yung sa malignant naman, usually ang nagpapalala into development of cancer, usually the use of tobacco and alcohol can also cause cancer of the mouth. Okay, here, the cause of unhealthy mouth, as I said, the use of alcohol and tobacco can cause many mouth problems, particularly tumors. Okay. So yung mga tobacco, magkakaroon ka ng staining of the teeth, you know? Okay, but the more serious one will be mga cancer of the mouth. So chances of having oral cancers are higher with smoking and using smokeless or chewing tobacco, yung mga nag-chew ng betel nut, ganun din, no? Maraming may cancer sa pasyente na tao nag-chew ng betel nut, no? Or drinking too much alcohol can cause cancer. So, this is just a summary, okay? Causes, injuries, infections, vitamin deficiency, chemotherapy, tumors, and then, so in terms of prevention, how do we prevent these problems and so as to promote a healthy mouth? So we should be vigilant against injuries. Okay, ingat lang na hindi natin makagat accidentally. No? Pag naranasan na nakagat na once, no? Next time, ingat na lang na huwag mo yung makagat yung dila, labi, no? Nandahan lang pag-chew. Okay. And then, dentures also, kung may dentures, ingat lang. Okay. Then, number 2 is oral hygiene. Dapat palaging malinis yung bibig, no? Because it can cause infection. It can cause, sometimes it can cause tumors. Okay? And then proper and adequate diet. Yes, because ito, sabi natin, one of the causes is vitamin and mineral insufficiency and also tumor. Diba? Okay. So, importante yung proper and adequate diet. No tobacco, avoid alcohol. So, the next one, in terms of prevention, No? Ito, more of the secondary prevention na. You want early diagnosis, di ba? Okay. So, do mouth self-examination at least monthly. Parang sa breast self-examination, dapat monthly. Neck self-examination, dapat monthly. No? So, usually, mga self-examination, do it monthly, minimum. No? You don't have to do it every day. Kung kaya mo every day, gawin mo every day. No? And after that, once you find something unusual, consult a physician right away para maagapan. No? So these two items below here are the so-called secondary prevention. And yung mga limang item above, we call that primary prevention, no? To avoid the development. So dito sa secondary, pag meron na, lumabas na, you want early diagnosis and treatment naman. No? So let's now go to healthy teeth. What are the parameters of healthy ngipin? So pag sinasabi natin isang tao na may healthy teeth ay wala siyang tooth decay or dental caries. Pero mahirap i-achieve yun, no? So, I for one have history of dental caries. I don't know. Well, I don't know. So kung tanong yung mga dentist na sila, pwede ba sila hindi magkaroon ng dental caries? Palay ko. Somehow, human beings naman sila, weaknesses din, most likely meron din. No? Okay. Then the other parameter for saying may healthy teeth, may dental caries ka, hindi mo pinagamot, no? So that is a parameter of healthy teeth. So dapat lahat na dental caries, dental decay, dapat gamutin. Pag andun siya at hindi siya ginagamot, then we label that person to have unhealthy teeth. So the other parameters would be, as mentioned earlier, hindi gumagalaw yung ngipin. Pag gumagalaw, may problema. And then, kung sumasakit, pag nag-chew, and also when brushing, may problema. So these are signs of unhealthy teeth. No? Ito pag may masakit, no? At gumagalaw. No? So how to promote healthy teeth? The most important strategy is to practice good oral hygiene daily. Daily pa. I have to emphasize daily. So number one, brush your teeth at least twice a day for 2 minutes each time. At least 2 minutes. Gusto nyo mas mahaba, pwede rin. But be careful na hindi rin masugatan yung gum o kaya magasgas yung ngipin nyo through excessive brushing. No? So as much as possible, do the brushing right after eating. Pinakamaganda dyan, every time that you eat, brush right away. Or at least 3 times a day. Kasi kung kumakain ka tayo, almusal, tanghalian, sa gabi, kakain ulit tayo at least 3. Kung may merienda pa, mas maganda kung magbabrush after the merienda. Okay? But that's hard to achieve. No? So minimum would be at least twice a day. Then also use a soft bristle brush. Okay. Huwag yung matitigas kasi it will destroy. Pag nagbabrush ka bisan, abrasion yung ngipin. Or even the gums, nagkakasugat. No? So, and then replace the toothbrush every 3 to 4 months para bago, no? In good condition. And then, or less than 3 to 4 months kung sira na yung mga toothbrushes niyo, especially when you use the toothbrushes of the hotel na inuuwi ninyo at ginagamit niyo for toothbrush, no? Hindi tumatagal yun. Baka 1 week lang yan, 1 use lang, tapos na. No? O, yung mga commercial brushes naman, kung minsan low quality, okay, wala pang 2 to 3 months, sira na rin. No? So, the other measure in terms of good oral hygiene, use fluoride toothpaste. So, kailangan ng fluoride. Okay? Fluoride sa ngipin natin in terms of health maintenance of the teeth. Then, floss. Kadalasan, marami tayo hindi nagpa-floss, pero importante yung floss. No? I've learned my lesson there. No? Yung floss daily. No? Pwedeng right after the brushing, mag-floss tayo. Okay? Or, sa gabi, mag-extra floss kayo, baka may naiwan sa, after toothbrushing, may naiwan pa yung mga pagkain in between the teeth. Okay? Then, eat sticky, sugary foods in moderation. I put moderation kasi hindi natin mapigil. Tako tayo, kakain tayo mga matatamis, no? It's sticky that, no? So eat them in moderation, but if you eat some sticky, sugary foods, brush right away para hindi mag-stick dun sa ngipin na matagal. Avoid tobacco use, and then also yung usually tobacco sa teeth yan, na? Okay, yung alcohol usually mouth ng problema. So after that, have a regular dental checkup and cleaning. Contact your dentist as soon as possible when there's a dental health. Okay. When you say regular checkup, usually I would suggest every 6 months or every year dapat meron. No? Just like for sa mga doctors, when you go to the physician, non-dentist, mas maganda kung meron yung regular checkup at least once a year. After, of course, meron pa yung self-examination. After the monthly self-examination, have it checked by the doctor at least once a year. Ganun din sa dentist, you have this proper practicing good oral hygiene, and then you also examine your teeth every month, self-exam, and then have a at least yearly checkup with your dentist. So yung sa dentist, usually they call it prophylaxis. Lilinisin pa rin nila yung ngipin ninyo para hindi magkakaroon ng maraming dental caries. So what are the causes? The causes will be kabaliktaran ng promotion. So the causes of unhealthy teeth is that if you don't practice good oral hygiene, kakaroon ka ng unhealthy teeth. If you don't brush your teeth at least twice a day, you're going to have unhealthy teeth. You don't use you use hard brush, yung hard bristle brush, magkakaproblema rin. You don't use fluoride toothpaste, you don't floss, you eat sticky, sugary foods all the time, madalas, frequently, and then you use tobacco, no? All of this can cause unhealthy teeth. And then if you don't also see a dentist for a checkup and cleaning, that can also cause unhealthy teeth. So I think I'm ending my talk on mouth and dental health. Okay. So I have discussed all these items. What is the mouth health, oral health, dental health? What are the components of the mouth? What are the parameters of a healthy mouth and teeth? What are the causes of unhealthy mouth? How to promote a healthy mouth? What are the parameters of healthy teeth? What are the causes of unhealthy teeth? And how to promote a set of healthy teeth. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on mouth and dental health. Knowledge is power, it gives power. Use the 4Ks of patient empowerment. The 4Ks will be kaalaman, kakayanan, karapatan, and kapangyarihan, which are under your control to gain greater control over decisions and make better decisions on any problems on the mouth and teeth. Okay. So with that, I end my pep talk. I hope I have empowered you to have an essential understanding of mouth and dental health in your health management. So before we go to the question and answer portion, reminder, please take the OLETE for Mastery of Learning. Have a certificate like this. If you will have a certificate like this if you pass the OLETE. And then 50 OLETE certificates will entitle one to a voucher for an ROJoson telemedical consultation. And then please put in your feedback in the chat box. And let's now have a group picture taking before we start the QA and interaction. Please show your beautiful faces in the video now. Okay, 1, 2, everybody. 1, 2, 3. Okay, so I have saved the pictures. The floor is now open for questions, reactions, comments, and also sharing of experiences. Anybody wants to start? I hope this is not a boring topic for you. Is it?
Ma'am Jocelyn T has a question.
Okay, Jocelyn T.
It says, I have an on and off slight cracks in both ends of my mouth. So if I open my mouth wide, it has slight pain, no pus. I apply virgin coconut oil to them, top up with a Chinese powder to for sore throat. The cracks heal but sometimes recurs. What may be the cause of that? Do I have vitamin deficiency? Thanks.
Cracks. Meron kang cracks ngayon. You have cracks now?
You unmute.
You have cracks now? Unmute.
No, Doc. Heal na yung cracks.
Okay. Sana meron, no? Para
I
makita.
know. Siyempre, ayoko yun.
Kabilaan.
Kabilaan dito.
Okay. Number one, how often does it occur?
Lately, mga monthly eh. Pero for a few days lang, basta na-feel ko na yung pain, ginagawa ko kaagad yung extra virgin coconut oil and the Chinese med.
Chinese med. Okay. We start, as always, we started first with the diagnosis, di ba? So, number one, yung mga data will be kabilaan, ankle.
Kabilaan, yes.
Nasa ankle.
Yes,
And
dito sa end.
Okay. Anong klaseng crack yung malalim, mababaw?
Hindi, mababaw lang. Mababaw lang.
Parang dry lang, dry skin, dry gano'n? Parang dry?
Parang dry lang.
Dry lang, okay.
Yes.
Kasi iba yung...
Walang pas walang sticky substance eh.
Yeah,
Wala ding sugat na malalim.
Yeah, okay. Tama, good. So, marunong ka pala mag-self-exam. So, you have to differentiate those things, no? Okay.
Yes.
So, kung parang crack lang, okay. And then, how often? Did it occur before?
Lately, parang monthly eh.
Did it occur before? Last year, 2 years back, 10 years back?
Meron din, pero matagal na yon.
Matagal. When was the last time?
Years back.
Years back.
Yeah. Pero lately, napapansin ko, parang monthly.
Parang monthly. So years back, kasi iniisip mo, baka may iniisip ka ng tanong mo, vitamin food deficiency, di ba? So i-compare mo yung duration. Kung years back, mas bata ka, ibig sabihin marami kang okay lang kinakain mo. Ngayon, konti lang ba kinakain mo? Konti na lang?
The same.
The same. Kung the same, most likely hindi vitamin deficiency. If there is kung di ka kumakain ngayon at you have the cracks every month, no, that could be related, no? Baka related yung cause, no? Okay. So baka if you ask me point blank kung ano siya, kung minsan I cannot really answer it in terms of the specific cause. We can call it non-specific lang, no? Okay, it could be due to, when you say non-specific, we cannot really identify. There's such a thing as non-specific, di ba? So in life, kahit yung mga problema, hindi natin ma-diagnose sa kotse. Kung isa, hindi natin ma-diagnose, no? Ganon, no? Non-specific, no? So ganun din sa health ng tao, we call that non-specific. We cannot really identify. So of course, we will try our best to identify the real cause, no? Para malaman na we know how to prevent it again, how to solve it, no? But a lot of times we don't know, no? We just have to keep on observing, no?
Doc, so, is it a sign of dehydration?
Possible, pero umiinom ka naman ng tubig, di ba?
Yes, baka kulang.
Pero kung kulang, pwede rin, pero usually bakit nasa site lang, di ba? Bakit
Yeah.
side lang, no?
Oo, bakit hindi full lips na dry?
So if
Oo.
you are, anyway, if you are trying to solve your own problem, okay lang, you try to think of all the possible causes and then you try to remedy it. By example, you drink a lot of water and see what will happen. Di ba? Okay.
Mm.
And then, but you put, okay, you put virgin coconut oil. Okay?
Extra virgin coconut oil.
Nawawala agad.
No, mga 3 days, ganyan.
May pattern. So, monthly na. Ilang beses mo na in-apply yun? Sabi
But,
mo,
3 months na.
3 months, every month.
Oh.
Meron.
Yes, pero for a few days only, it will heal.
So, 3 months na ngayon. So, next,
Yes.
you expect it to come again next month?
Sana mog na.
Okay. So, it might be due to the environment that you are in. Kung ganon. No? Environment means could be the food that you're eating, also the weather. No? Ganon. Yung weather, walang kinalaman.
Wala. Constant naman.
Baka nasa air-conditioned room ka o nasa labas ka.
Constant lang, constant.
Okay, constant. Kamisan, di ba, you those who go abroad, no? When you go abroad, you change of temperature, kakaroon ng mga dry mouth, no? Ganon. Does it feel the same? Parang when you go, I suppose you've gone abroad, magkakaroon ka ng,
Yeah.
does it feel the same?
Hindi naman na dahil I'm in a cold climate tapos nagkakaganyan, hindi ganun eh.
Hindi. Okay, so specific that we cannot really identify.
Yes.
Okay. Don't go.
Doc, do you suspect ano yun? Zoster? Herpes?
Herpes zoster? No.
Uh-huh.
No, usually herpes
No.
zoster isang ano lang yun eh. Isang episode lang, no? At usually 2 months, 3 months tuloy-tuloy yon, no? Before it heals. Matagal yon. Masakit. Masakit, no? It's not only for 3 to 4 days, no? Pag herpes zoster, usually one side lang. One side lang yun. Hindi siya bilateral, kabilaan, no? Number 2, usually masakit siya, no? Number 3, usually tumatagal ng ano yan. Kahit na maglagay ka ng mga antiviral ointment, no? Yung Sovirac, yung mahaba gamot, it will be here for about 2 months at least. 2 months. Tuloy-tuloy. Bago gagaling siya. Okay? So, I won't say hindi naman masakit, di ba?
Hindi.
Okay. So, baka the other type of viral infection is herpes simplex.
Simplex.
No? Yung singaw, no? Pero usually, sandali lang. Pero 3 days. 3 days masyadong madali. Usually 1 week pa yun eh. Yung mga herpes simplex.
Kasi wala siyang sugat eh. Alam ko kasi yung singaw, may makikita tayong, yung sa sample picture niya po.
Yeah, may
So
ulceration.
parang merong puti na ilog. Ito wala eh.
Wala. Okay. Baka ano lang, baka sa weather lang yan. No?
I will continue to observe na lang.
Yeah, continue to observe. Tingnan mo rin, you don't put virgin coconut, i-experiment mo rin. If you don't put virgin coconut oil, saka yung Chinese medicine, see whether it will disappear by itself.
I dare not stop them. Masakit eh. If I open my mouth wide.
Konting
I
tiis.
just want to share, the Chinese medicine I'm using is called Song. It's galing sa ampalaya.
Okay.
Ay, watermelon pala, sorry. Galing sa watermelon na ginawang powderized. Available yan sa mga Chinese drugstores.
Okay. Anong pinopromote nila doon? Anong usefulness?
For sore throat.
Sore throat?
Or any sugat or singaw inside the mouth. You just spray it on. Medyo bitter siya, pero effective.
So spray yun, spray?
Yeah, spray. Nasa isang Can I share it dito? Kunin ko lang.
Yeah, sige. Okay.
Can you hold?
Sige. So while she's looking for it, any other comments, questions?
From Maria Hustapolotan, sharing what my dentist told me.
Okay.
Floss before brushing.
Okay. Floss before brushing. Okay. So how do you find that experience? Ano? Ako, I usually do the flossing after brushing. How do you find it? Ano experience mo, Maria Justa?
Okay lang po. Kasi sabi niya, it's better daw to floss because, ano ba yun? First of all, you loosen yung debris
Oo.
in between your teeth. And then, then you brush. Tapos, it helps you retain the fluoride more if you floss before you brush.
You retain the fluoride more if you...
You floss before you brush.
Kasi hindi mo tinatanggal yung yung fluoride after brushing. Yung sa brush kasi
I guess so.
toothpaste.
Oo.
Okay.
Oo.
Sige, we can try.
That's what
Well,
said.
sounds
So I
sensible.
followed her. I followed her. Hindi naman ho. I just followed her. I mean,
Yeah. But after
okay lang.
following it for how many years?
Ay, matagal na po.
10 years na, 20 years.
Yes, oo. Matagal na.
Did it prevent dental caries? Hindi.
Ano naman ho, yes. I haven't really had any cavities.
Wow, ang galing. Okay.
Wala. Except yung natural, like, kasi ho, yung dating filling, kasi my mom was also a dentist. But yung nilagay niyang filling, yung bawal na ngayon, yung mercury.
Yung mercury, okay.
Because during her time, yun lang ang filling. The white one was just temporary. So that's the permanent one. That's so permanent pala ho that it's stronger than the enamel of your teeth.
Yeah.
So ang nangyari, nag-expand siya. The mercury expands. So if like me, I always I chew more often on one side. So okay yung side na yon. Pero yung side na where I don't chew, na break niya yung enamel nung teeth. Kasi as you grow older, the enamel also becomes weaker.
Yeah.
So it broke the enamel. So ang repair work was naiwan yung teeth. They had to put a porcelain jacket. Pero they did not remove anything. They trimmed it. So that's why now they don't really use the mercury filling anymore. It's always the white. Kasi nga it's, first of all, it's poisonous. But I'm still alive. I guess I wasn't poisoned.
Konti lang kasi.
Konti lang, oo.
Konti lang.
Tsaka if it hasn't done you any harm naman, it's best to just leave it na lang. Rather than have it all taken out and replaced.
Yeah. Okay.
Pero okay lang ho. Wala naman ho.
So how many years ka nang walang problema sa ngipin? Nakakaingit ka naman?
Since forever. Wala ho talaga. I've not had yung mga cavity or butas or what.
Magandang gene mo.
Yung lang ho, remember yung you took out that wart on my tongue? Yun yung nag-cause kasi nga she had to leave when she did the work on those teeth dito on this side. So she couldn't she had to leave it first na gano'n, hindi pa niya kasi malalagay yung jacket. Doon nasugatan yung tongue ko.
Okay.
Kaya kasi it was rough
Yeah.
So
but in terms of dental caries, in terms of yung gingivitis, walang maganda yung gene mo. Ako, naiinis ako sa mga ganun. Sumasakit.
Oo. No. Talagang dental dental hygiene, ganun. Brush 3 times, floss, and then mouthwash.
Yeah. But we all agree that pag may problema sa dent, kahit sa ngipin lang, ang sama ng pakiramdam mo, di ba?
Opo, opo. And um, my dentist also told me that sometimes if you don't attend to your teeth, talagang sasama yung katawan mo.
Mm. Sasama
That's
in
why I
what
said,
sense? In
kasi yung minsan yung infection, it
ah, yeah.
really travels.
Oh, yeah.
So
Okay.
sabi niya, it's best to,
Yeah. Pag
kaya
may
she
infection.
told, opo, kaya talagang kailangan ni ano, kasi
Ah,
some people, sabi niya, nung binunutan niya, they felt much better all over physically kasi nga
yeah.
natanggal yung source of infection.
Yeah. Kung may
Kaya
infection.
very,
May
very
infection.
important talaga yung
Oo.
teeth.
Oo. Pero before the frank infection will set in, usually masakit, dental caries po na masakit,
Opo,
na hindi ka
opo,
makakain.
opo. Sabi nila, hindi ka na makatulog sa sakit.
Yeah.
Talagang
Talagang,
it's bad.
parang pinoproblema mo yun. Paano ako kakain? Paano? Okay.
Oo.
So it's
Mahirap
good that you have a good
yan.
gene, no? Okay.
Opo,
So,
knock on wood.
knock on wood. Okay. So I think going back, I think pwede naman kasi you use a dental floss mo na parang kasi kung minsan malaki yung chunk ng debris between the teeth, di ba? So, pwede mo tanggalin mo na then brush it, di ba? Okay.
Opo.
So ako naman, I usually, yung mga malalaki, I try to remove it with the brush. Ang hirap na tanggalin, di ba? So, pag mahirap tanggalin, pina-floss ko na lang, no? Then, I can go back, no? So, floss, then brush mo na, then back and forth, gano'n, no? Basta the end point is that I feel it's, wala nang nakasingit doon. Okay? Yan ang nakakatakot, yung nakasingit sa between the teeth, eh, di ba? Okay. Okay, so just be
Ito na.
flexible, pwedeng mauna yung floss, then brush, or pwede ding balikan yung floss after brushing, or mauna yung brushing, then floss. No? Okay. Okay. So ano pa? Sandali
Okay, ito na yung gamot.
Sandali. Sandali, turn off. Somebody turn off my lights here. I'm in the operating room of PGH. Okay. Yeah, what's the name? Okay.
Ito yung bottle inside the box.
Okay.
I'm not selling I'm just sharing na
Oh.
effective ito sa mga ulcers inside the mouth and sa sore throat pwede rin.
Okay. So actually there are a lot of medicines like that, di ba? Yung mga Western medicine, not Chinese medicine, meron din. So how do you compare? Have you experienced?
This one very cheap lang. Tapos parang hindi naman siya antibiotic kaya safer than antibiotic.
Yung iba naman, walang antibiotics din. I forgot the name, pero mahal na yung ini-spray.
Camilosan.
Camilosan. There's another one. Marami yan, maraming klase. May spray. No? I just cannot remember those names. Anyway, if your experience, walang antibiotics yan, then what's your experience?
Wala.
Nag-spray mo, nagnanam?
No, hindi siya nagnanam. Ano lang, parang mentally yung feeling pag nasa inside ng mouth at saka bitter.
Bitter lang. Okay.
Safe naman na maswallow.
Okay. Sige. So,
gamot yan kahit nung bata pa ako meron na this medicine I'm already past 60. Senior na po.
How much is that?
Mura lang. Pero this one, my husband bought sa Hong Kong. Pero dito sa Ongpin, marami yan.
Okay.
Oo.
Sige. So, thank you for sharing that information to us. No?
Okay.
So, if she's not selling, it's not, but take note of that. Baka you might want to use it, try it. No?
Maraming may singaw. They're using this.
Yeah. I can tell you my experience. Meron akong every now and then. The last time that I had singaw was before actually during the pandemic, nagkaroon ako ng singaw. And then wala akong medicine. No? I just wash, just the usual oral hygiene. Then
Salt.
after 1 week,
Salt water.
after 1 week, kusang nawala. Okay?
Mm.
So it's really a question is whether you really need that medicine or not, di ba? Kasi saan may self-healing ka di ba? Okay.
Yes.
My herpes zoster, ganun din ako. May herpes zoster ako. Not on the mouth, but at the back, no? I didn't use the expensive antibiotics, no? I just have to take painkiller kasi masakit, no? And then pero matagal, no? Yung sakit yon probably lasted about 2 weeks, no? Yung sakit, no? Pero the complete healing, yung nawala na yung scar, yung bakat, no? Usually it took me about 2 months bago nawala, no?
Dok, totoo ba pag yung herpes, ano tawag doon kanina? Herpes ano yun?
Zoster.
Pagka na-complete niya yung end-to-end na ikot, if the one end meets the other end, mamamatay na yung patient?
Hindi.
Ha?
No. I think it's a myth. It's a myth.
It's a myth.
Yeah. Okay. So, anytime you can develop herpes zoster, no? Anywhere, ang delikado lang, baka doon sa mata, malapit sa mata, no? Ganon. Pero kung hindi yung myth, kasi usually nag-occur in a branch of, it's a nerve branch, diba? Isang branch ng nerve pattern, no? Ganon. So, ano yung end? Kabila?
Ay, basta yun yung naririnig ko eh.
Marami tayong naririnig. Saka maraming nerves yan na pwedeng tamaan eh. No? At mahaba yung nerve, di ba? Yung sa akin, from here, from the back to here. Diba? Ganun kahaba. Okay. Pero nawala na. No? Mga 5 years, 6 years na ito. Ganun. But I didn't take any medicine. I just wash it with soap and water and then rely on my healing power.
What is that?
Host resistance, healthy diet, healthy lifestyle. Yun lang. Na? Okay. So not everything naman, whenever you have problem, you don't have to take medicine all the time. It can heal by itself, di ba? Okay. But it depends. Kung cancer, we don't say it heals by itself.
Yeah.
So yung mga infection, virus, yung mga sugat, it will just heal by itself kahit na wala kang gamot na nilalagay. No? Okay?
Thank you, Doc.
You're welcome. Any other questions, Abet?
There's nothing at the chat box.
Okay. Anybody else who want to share? Loss. I just want to have a survey. How many are using floss? How many are using floss? Show of hands. No? Apat. So, hindi lahat. Okay. Lahat ba? Lahat. Okay. Nung bata-bata pa ako, I don't use floss. Basta toothbrush lang eh. Pero after a while, I started realizing the importance of floss. Then I floss.
Doc, yung teeth ko kasi mahirap i-shoot yung floss eh. Masikip masyado.
Maganda
May floss na manipis ah.
Oo. Nahirapan ako. So I just bought yung dental tools. Yung may hook, yung manipis lang na may hook. Yun na lang ginagamit ko pang clean.
Okay. Sige. Whatever which will be suitable to you. Kasi may mga dentist nagsasabi, you don't use yung mga hook, di ba? They prefer yung mga floss. Ganon. Yung toothpick, ayaw rin nila, di ba? They don't advise using toothpick, di ba? Pero sa restaurant, dapat halos lahat may toothpick. No? So probably they should also provide dental floss sa restaurant. Diba? Okay. So any more comments? So I really wish that all of us will have good teeth. No? Yung mouth problem naman, not no common, but the more common problems, teeth, di ba? Yung teeth. Pag nagkasakit yung teeth mo, na kumakain, ang sama ang pakiramdam mo. No? Kung bakit pa nangyari ito sa akin? Then I have to see a dentist, I have to, hassle, di ba?
Pag yung TMJ patients, nahihirapan na. TMJ,
Oo.
tooth, mouth, jaw problem.
Yeah. So, anong tanong mo?
Nahihirapan yung mga pasyente na may TMJ problem.
Yeah, kasi because of the opening of the mouth, mahirap talaga yan ng TMJ. No? But that's another problem. That's another problem aside with teeth, di ba? Okay. So I wish all of you will have good teeth. Huwag niyo patanggal, ha? I committed to some mistakes in the past. Inis na inis ako sa mga feelings, mga pinifeel lang. Inconvenient. Pinatanggal ko na lang, pinabunot ko. No? So, kasi kung minsan dentist will ask you, what do you want? What do you want? No? So, pagtsagaan mo na lang, feelings na lang. Kasi it's hard to chew with dentures.
Yes.
Di ba? So, try to preserve your teeth as long as possible kung pwede. Huh? Okay. If you want to enjoy eating, I think in the end, baka eating na lang yung kaligayahan natin pag matanda na tayo. Diba? Okay.
Tama.
Okay?
Sir, from Rex Tolentino.
Okay, Rex.
Good day po, Dr. Ray. Ask ko lang kung safe po bang operahan ang diabetes?
Ang diabetes, anong klaseng operasyon gagawin? In general? In general?
Ano po ito yung nagkaroon ng
Hindi
Can't
tama.
hear you.
Yung sound, hindi ka namin marinig. Anyway, ang sagot ko dyan, it depends, no? Kung severe ang diabetes, it has to be controlled first before the operation. No? Kung mild diabetes lang, hindi naman delikado. No? Kung mild lang. Especially kung minor, yung simpleng surgery lang gagawin. No? Ganon.
Doctor, he added sugat sa paa.
Kaya nga, so anong operasyon gagawin? Itatahi, sugat sa paa, may diabetes. Kung may sugat, number one, kahit na may diabetes siya, kailangan gamutin. Pero bakit mo operahan? Baka may siya, baka meron siyang diabetic gangrene sa paa mo, very common yon. No? Kasi yung mga may diabetes, minsan nagkakaroon ng sugat sa paa to the point na diabetic gangrene, bulok na yung daliri, yung dalawang toes, kailangan putulin na. No? Di ba? Yung ba yung scenario mo?
Sir, eto good day po. Ask ko lang po kung okay lang po ba na operahan ang diabetes without conducting first the lab test. Inoperahan po ang mother-in-law ko. Alam na nag-opera sa kanya na diabetic ang patient niya dahil una na niya tong naoperahan nung i-amputate niya yung isang daliri sa paa. After 2 years, nagkaroon ulit na sugat sa paa at ina-advise kami na operahan daw ulit. Nagtatanong kami kung need pa munang i-x-ray. Ang sabi niya, hindi na daw. Diretso na daw opera. After more or less 2 weeks na operahan, ay lumala yung sugat hanggang sa tuluyan ng amputate hanggang below the knee. Ang questions in mind pa po namin ay bakit hindi muna pinag-lab test para malaman if safe na operahan dahil alam niya namang diabetic. Ang sagot niya lang sa akin ay walang mali sa opera niya, malinis daw ang opera niya. Ang problem daw ay nasa sistema na daw ng katawan ng pasyente.
Okay. So tama pala yung direction ng answer ko. So yun, no? Diabetic gangrene, no? Okay. So thank you for that question. But before I answer that, test ko lang, any reactions from the audience? Anong reactions niyo? Paano yung mag-react yung kay Rex? Yung sinasabi niya kung kailangan pa ng lab test before the operation, di ba? Essentially, yun ang tanong mo. Kung kailangan, bakit hindi pa gumawa ng lab test before the operation? Anong magandang sagot doon?
Di ba lahat ng diabetic patient dapat may mga certain test na dapat gawin? Pumasa mo na sila bago pwede i-opera.
Okay? So, as a rule, that's correct, no? Okay? So, kung gusto nilang malaman yung level ng diabetes niya kung gaano kataas, no? Okay. So, yan ba yung question mo, Rex? Okay. So, pag may diabetes na, kahit na alam na may diabetes, kasi hindi natin alam, at a certain point in time, sa isang araw, kasi yung level ng yung sugar mo does not remain constant every day, no? Kahit na every day lang nagfa-fluctuate 'yon, no? Okay. So you really have to have a test of the blood sugar. Kaya napapansin niyo, those who have been operated on, pag na-hospital kayo, merong yung tinatawag na CBG, every hour, every 20 minutes, yun ang mahal doon, di ba? Monitor yung blood sugar. No? So that's the reason. No? You have to monitor the blood sugar before the operation. No? Kung masyadong mataas, bibigyan ng gamot. No? Okay? Pero hindi yan ang, kasi the other part of your question is kasi hindi siya gumagaling, di ba? Hindi gumagaling, niya. Tama yung doktor niyo, yung diabetes na yun, nasa sistema na, no? Okay? Kasi paulit-ulit lang talaga yon. When you have diabetes yun, kasi yung mga blood vessels sa buong katawan, medyo makipot na, masikip, no? Okay? Particularly doon sa tuhod, sa paa. Kaya that's why it's very common to have diabetic gangrene, no? Gangrene means nabubulok, umiitim yung paa, no? Okay? So, kaya yung mga doctor usually, kung isa lang daliri ang maitim, isa lang tatanggalin. Pero it doesn't guarantee na may susunod pa isang daliri. No? Okay? So, tinanggalin second daliri, walang guarantee na mag-cure. So, kaya pwedeng sumunod na yung buong paa naman. No? Then, kung tinanggal yung buong paa, wala rin guarantee na baka aakyat dun sa tuhod. No? Di taas. Kaya puputol naman, no? So yan ang challenge sa mga may diabetes, no? Yan ang nakakaawa, no? No. So, tama yung doktor, nasa sistema na yon. It's not really because of the monitoring. Pero ideally, dapat may monitoring before the operation, no? Okay. To make sure na hindi siya nagkaroon ng diabetic, yung mga crisis, no? Yung hyper diabetes, yung biglang taas o biglang baba, no, ng blood sugar, no? Okay? Okay. Na? Wala na. Okay. So it's okay. 3:12 already. So we'll call it day. Okay. We'll see each other next week. Ano bang next week? So, kalimutan ko na anong prepare ko, but I'll announce it in the Facebook. Na? Okay?
Thank you, Doc. Bye-bye.
Okay. Bye-bye.
Thank you, Doc. Bye-bye.
Bye-bye.
Thank you po.
Bye-bye.
Thank you po.
Okay.